8 too. If you hear an alarm, get your butts up and go to a door, go check on your patients, go do something. We recently, about 4 years ago, they had a mock code pink, and the doctor did not have a pink around the badge, so that means they are not doctors permitted on our unit. This means that we're able to touch babies, the pink.
That's cool.
They did not have that, and nurses were letting the doctor in and out of the unit while the alarm was going off. He had a duffel bag.
Oh my goodness.
Other nurses were just sitting there. The alarms were going off. It was all video recorded. So we had to go to a staff meeting and watch this, and it was embarrassing. So with students too, get up. Our director comes out, everyone comes out. The worst thing is if you guys are sitting there while the alarms are going off, okay? Get up and move. Help, do whatever you need. Even if you stand at a door. That's my favorite job. I'm like, oh, I got the door. So I'll just stand at the
So
door.
are you checking your babies first and then the door, or the door and then the baby?
Everyone kind of goes everywhere. So the nurse who has babies needs to go check babies.
Okay.
However, if you're in labor and your patient's pregnant, you're just going to go stand at the door. Okay. If you check your babies and there's an open doorway, usually it's pretty, and then they work on the alarms. So that's why we get kind of jaded because we hear it all the time. But seriously, everyone needs to get up and
Yeah, I was gonna say, like, how often does it happen, like, accidentally? Like, if you forget
a lot.
to turn it.
If the baby pees on it,
Oh, okay.
if it gets wet at all. We've walked in and grandma has the baby, given the baby a bath without asking, and has the alarm on. It's not going to electrocute or anything.
Yeah.
It's just,
Okay.
But yeah, so if you hear it, go.
Yeah.
Okay. So we're going to take that band off, okay? So our water's here. This has no soap. This has soap, right? Okay. So how do babies lose heat?
Their head.
Heads.
And wetness. So we're going to take the baby and have the baby wrapped nice and tight and swaddled. We're going to hold the baby like a little football. Okay? We're going to support the neck like this. We're going to take the hat off. We're going to take this wet washcloth with no soap, and we're going to wipe the eyes from the inside out, and we're going to wipe all around the face. Okay? That then goes in our soapy water, because that's going to wash the baby. We're going to take our sponge, and we're going to sponge the head with lots of water, because think about this has been 4 hours of crust, blood, dried vermin, dried amniotic fluid. So get it nice and wet, and then you're going to take and you're going to scrub the head to get all of that out. If you feel it, it's not rough whatsoever. You're not going to hurt the baby.
And the nurses will
Huh?
say, all right, for me.
You know, isn't this like what they use in the
NICU.
surgeons?
I like that. That's nice.
So you're not going to hurt. So I say that because the students are like, and I'm like, you're not getting nothing. You need to scrub. When you push in, it's not going to hurt. Okay, so you need to scrub. And then if they have a lot of hair, you got to scrub. You're going to take your dry one and you're going to dry the head completely. If you look and it's all this blood there,
Clean again.
clean again. Sponge and scrub. You only want to do twice, even if you wipe it again and there's some. It's not as much as before because they're going to lose that heat. We need to keep, okay? So, okay, we got it nice and dry as we can, okay? And then we're going to take and we're going to lay our baby in our crib.
Are we gonna put the hat on the baby back?
Not
Not yet.
We're going to take our diaper and we're going to submerge our baby in the water. So you're going to submerge the baby and you're going to do just a nice quick under the arm bath. Again, if they're full of Vernex, you don't have to scrub vigorously because it's a moisturizer. You want to wash, and then I always hold the baby like this to do this part because you're supporting the neck but you're not choking the baby. And do the back, and then the butt and genitals are last, cleanest to dirtiest, okay? Then what we're going to do, we want to take our towel, and we're going to lay our baby in our towel, and wrap the baby in. Go to the crib, and now we're going to completely dry the baby, okay? It needs to be a fast. You guys are nervous, but we have to kind of be fast, okay?
Baby gets cold.
It's cold. Once you dry, you want to replace this towel. So sometimes I'll put both towels down because you don't ever want to leave the baby on wet linen, right?
This is gonna be in the vein still.
Then what we're going to do is we're going to go ahead and put a diaper on.
Right here, over the.
One somewhere. can use when you're ready.
It's right here.
Okay, that's, I'll do it. We're gonna put the alarm back on and reactivate it. And then, the only thing they can wear is the white t-shirts, okay? We don't give the YRMC ones anymore until they're ready to go, because we were going through a bunch of them, because if they fit up, mom wanted another one. So that's like a going home present. We don't give them, they have white t-shirts in the linen cart, so you can actually grab the t-shirt when you grab your towels and everything. If mom wants to do skin to skin, they can do skin to skin, we don't have to put anything on them. But the white t-shirt and one blanket. So with babies, we don't want to overcook babies, right? We don't want to put them in warmers, we don't want to overcook them. And so, I don't pick on, but the Hispanic grandmas want to have so many blankets in the crib that you can't see the baby, right?
It's so true.
And they're like the fleece blanket, and you're like trying to find this baby under all these blankets. So they only need one extra layer than we need. So if you're comfortable in a shirt, they're comfortable in a shirt and one blanket. Old school nurses want to always do 2 blankets. 2 blankets is not going to overcook. 2 receiving blankets is not going to overcook the baby. Okay. 2 receiving blankets, a fleece blanket, and yeah, that will overcook the baby. Okay. So we're going to put the diaper on. We're going to get a new hat. We're going to put our hat on. If we put the t-shirt on, t-shirt's fine. And then, oops, we're going to swaddle if they don't want to do skin to skin. So how you swaddle? You take the blanket and you put a corner down. Now this baby isn't as big as a regular one, but and then you lay it here. You want to put the baby's head right here at the corner, and you're going to take this little pocket here and put it in the arm. And then you're going to go over, and this goes up, and you can actually tuck that in or leave that. And then this little pocket will have that arm, and then you go like that, and there's your little swaddle, okay? Make sense? Okay. And again, they only need 1 extra layer. If you do 2 receiving blankets, you're completely fine. That's how my brain works. I always get 2 and do it with the t-shirt. And if they don't have a t-shirt, you will need 2 because they need 1 extra layer than what we're comfortable with. Okay? And you're gonna get rid of everything, put everything in the linen cart.
Do you ask mom if she wants to do skin
Mhm.
before you swallow it?
Okay. If they have hair, you can brush the little hair.
Do we change the,
Nope. So this will actually have a receiving blanket over it. That's why you have the towels. Okay. So you're gonna, all your cribs should have the pillowcase with the receiving blanket over it like this. And then they lay on that. Okay.
How do you deactivate and activate the
So you
sensor?
use this activator. It's 7139 to activate, 7139 to deactivate.
Also, there's a code.
And I'll walk you through
Okay.
it when we do
Is
it.
that like at the nurse's station? Okay.
There's one, yeah, and as we do our tour, you guys will understand what I'm